We are here today at the Arthritis Broadcast Network booth at the Canadian Rheumatology Association annual meeting, interviewing the Three Musketeers of traditional Chinese medicine, or they're doing a workshop together on it, so they must be the Three Musketeers. Introducing to you, on the left is Tsang, in the middle is Koehler, and on the right is Simon Huang. And I will do half of the interview in Guangdonghua, Cantonese. Ian, 你自我介紹先。
What did you say?
自我介紹。
Introduce yourself.
Oh, I see.
Something wrong with his ear only.
No, my English is not that good. I am Ian Tsang. In Chinese, Tsang, in Mandarin, Tsang. I'm one of the oldest practicing rheumatology in Canada. And actually, it's debatable whether I am the oldest in Canada. Here you are. Barry Koehler. Dr. Koehler.
I'm Barry Koehler. I'm a rheumatologist as well, practicing clinical rheumatology. Also a member of the UBC Division of Rheumatology, past president of the Canadian Rheumatology Association, and that's probably enough.
And I guess I'm Simon Huang. I'm
you guess? What do you mean you guess?
Well, the reason why is that in front of these two professors, I'm only a clinical associate professor, so I'm always very humble in front of these two older guys. Although having said that, I'm also past 65, I should be retired. So I am a rheumatologist in private practice in Vancouver, just like two of them also, but also teach at UBC. 即係話咧，我唔單止係即係睇病嘅，仲有些少教書。
Rheumatologist 中文係咩啊？
風濕病專科。
風濕病專科。
風濕病專科 So Ian, Barry, and Simon did a workshop called Should Rheumatologists Incorporate Traditional Chinese Medicine in Their Practice? 你哋可唔可以講解下你哋喺個 workshop 度有啲咩 highlight 想同啲觀眾講
Actually, what we did, the topic of the conference is not what you just said. We changed the topic. The topic, we asked a question, traditional Chinese medicine, is anything we can learn from it? So that we'll try. And I present 4-minute talk telling that there should be something we can learn from traditional Chinese medicine. And Dr. Koehler presented another 4 minutes, say that there's nothing to be learned from it. So Dr. Huang summarized it and say that we are all right, none of us are wrong, but we just have picked out what to learn from it. Maybe Simon, you can tell how we should learn from TCM.
Well, this is actually all Ian and Barry's idea because they've written 2 editorial on that stuff already. And in essence, then I guess the first step we need to know is whether the stuff actually works or not. So it needs to be studied. So we actually in the West, quote in the West here, have expertise in looking at outcome, designing clinical trials. And then it's still not quite at that stage by and large in China. So in fact, what we've done actually in China is that we started a small pilot project and see whether it does actually work in one of the rheumatic diseases, namely ankylosing spondylitis, comparing a standard Western treatment versus a pretty well standardized TCM treatment in a specific group of TCM patients with ankylosing spondylitis. You want to say that in Chinese?
You said so long, it's difficult to memorize it. 我哋而家喺中國咧，喺廣州咧有一個少少嘅研究計劃，係用呢個係揀一批強直性脊椎炎嘅病人，係滿意到我哋西方嘅診斷，亦都滿意到中國嘅中醫嘅診斷。然後呢班人咧，我哋將佢分開，一半用中醫，一半用西醫。咁然後咧，我用西醫嘅方法量度佢哋嘅結果，希望可以揾出嚟到底中醫有冇用，或者西醫比較中醫有用或者冇用。
And now Barry will probably tell us exactly what English I should be using.
We'll let you go with what you have. But I think the reality is that with any therapeutic intervention, it doesn't have to be physician, it doesn't have to be TCM versus Western medicine. There's a need to evaluate what you're doing and recognize the natural history of the disease. People have this tendency to impute their own ideas of what's going to happen, and if things change, they think, oh, that intervention changed things. The reality is, unless you look at it in a consistent fashion, you won't know. Arthritis particularly, but just think, if you didn't know anything about the common cold, and you say, oh, I have this wonderful treatment for the common cold, you know, all of my patients nearly all get better, and they do it in just a few days. But I would say, but I've been studying the common cold, and guess what? Everybody gets better in a few days. But if you've never looked at that reality, then you're very naive. And this includes physicians, this includes almost anybody doing therapeutic interventions. They have a tendency to want to be there to help people. They think they're helping people, but they don't understand basically the natural history of what's going on.
In Canada, do you find that TCM is more acceptable or popular in certain provinces versus other provinces? 我問佢哋喺加拿大有冇某一個城市啊或者省係比較會用中醫嘅方法嚟醫個病？
Ian has all the statistics on how many TCM colleges there are.
Actually, I don't have the statistic to back up what I say, but I will say something anyway.
But which province has TCM colleges?
There are two provinces in Canada have College of TCM practitioner and acupuncturist, and this being BC and Ontario.
And the reason for that, of course,
and
is...
the reason for that, because the more traditional Chinese medicine practicing Chinese medicine doctors.
And also more Chinese in these two provinces.
So I would say, to answer your question, is that probably BC and Ontario, and particularly the major cities that have more people using traditional Chinese medicine.
And for people who are not familiar with TCM, what are the different forms of TCM?
Well, in the old days, TCM kind of divided into northern part and southern part. And I think the reason is that because the climate is different, and also the way they grow the herb, you know, different area grow the different herb that is different efficacy. But nowadays, because the communication and the traveling is so convenient, so I don't think there's any major difference in terms of their thinking.
But I think the one thing that you actually taught me before was that
did I teach you anything?
Because there are three different aspects of TCM. Practitioner, you may as well expand on the other two.
Yeah, that when we talk about TCM, particularly in the Western society, and you're actually talking about three different things, and a lot of people actually look at it and don't know what they're talking about. TCM theory, I use the term theory, and TCM practitioner, and TCM herbal medicine. And the theory may be good, but if the practitioner is not good, they're no good. The practitioner and the theory may be good, if the herb they use are no good, they're no good. So when we say whether TCM works, and we will have to look at it whether the theory don't work, or the doctor is not work, or the herb they use is not work. Now,
so I was going to actually say that the thing that maybe you could ask Barry to explain is why is it there's so much confusion about the TCM theory, about the kidney and all that sort of nonsense.
Before she did that, I just said, the problem with the theory probably is not well studied, but the TCM practitioner has a major problem. It's hard to know which TCM doctor is a good doctor. And even with the college that established the standard, we still have difficulty knowing which TCM doctor is better qualified than the others. And the herb is particularly troublesome. I know a friend who imported Chinese herb from China, and wholesale to the TCM doctor practicing in Vancouver area. And he told me that some TCM doctor want to buy the cheapest one, and some TCM doctor want to buy the most expensive one. Now he has a lot of business ethics. He didn't tell me who, but you wonder, which TCM doctor is a better doctor. Okay, I finish.
No. Well, a couple of things. I think that whole issue of TCM probably tried to explain things to Western physicians way back when by putting it into Western terms. So they talked about renal syndrome and liver syndrome. That's nothing to do with your liver or your kidney, nothing at all. So there's a big gap in which Ian can expound on, and I've learned a lot from him about that. But it's a different concept altogether. But again, to add to what Ian was talking about, I had one of my patients this past week who's a researcher in herbs, and he was working, he's at UBC working with the pediatric group, and they had an area they wanted to study on using a particular intervention that they thought might be useful. So he went to a great deal of work to convene a meeting of 28 TCM colleges in China to get together with the researcher group from the Children's Hospital to see if they could set up a protocol. They had 28 schools. They had 28 different protocols of how they treated this. They couldn't do the research study because even the TCM practitioners didn't do anything the same way. So it's a very almost random type of thing. When we were designing our ankylosing spondylitis study, we had to really work to get the TCM doctors to agree to one protocol for treatment.
This is one facility.
One facility, and they wanted to, well, we could do this, or we could do that, or we could do the other.
So it's like the three of you guys together and you're trying to agree to one thing, right?
Well, we
agree.
The thing is that, when you do the TCM clinical research, you have to standardize three things. One is the practitioner, what theory they use. Two is that the practitioner. Three is that the medicine they use. So we go to one leading Chinese medicine university, so we standardize the training. We get one of the leading professors at the university, so we standardize the person. And we also use the medicine that university teaching hospital use, so we standardize medicine as well. So you have to standardize this, or else the variable is just a lot.
See, if the three of us sat down and said, how are you going to treat ankylosing spondylitis?
Easy.
It's very easy. We're in agreement. We can set up a protocol very easily.
We have guidelines and we've got chemicals that are standardized. They don't have guidelines on chemical standardization.
And you guys didn't mention acupuncture. Is acupuncture considered TCM and also cupping? So acupuncture, Tsang.
Go ahead, Ian.
But, we are talking about something that we don't know what we're talking about. You're talking about acupuncture. As I said, I'm quite sure that acupuncture works on certain conditions, but who's doing it? And what condition you're treating? And what kind of outcome method you're using to measure? So the same thing with cupping. Again, there's with other modalities. So quite often I see a patient who's Chinese, and then when you examine them, they got red marks all over their back. So if purple, okay, I'm colorblind. But if using that as example, cupping doesn't work. Why did I make the decision? Because if it worked, I wouldn't be seeing the patient, right? But does it work? I don't know.
But again, it would be, if you had, for argument's sake, 3 different TCM practitioners, one might utilize acupuncture plus some herbs, another might utilize herbs plus cupping, a third might use bee stings plus herbs plus acupuncture, and putatively they're all treating the same thing. And so then it becomes an issue of, do they know what they're treating? has there been any standardized evaluation? And the reality is, for most circumstances in TCM, that hasn't happened.
Actually, you need to translate this for me. The TCM teaching is that in Chinese, 同病医治，医病同治，同病异治，异病同治。
You better do it yourself.
So that means that from a TCM doctor, when they look at a condition, say the liver is overworking. So some TCM doctor will say we suppress the liver, but some other TCM doctor will say I don't suppress the liver. I will encourage the spinning to suppress the liver. So they're all doing the right thing according to their thinking. So how are you going to study that? You know, if you have a different doctor treating the same condition differently. So that's why when you design a research project, you have to put that into consideration. Now I'm a little bit daring to say that some of the Western doctors doing TCM clinical research don't put that into consideration. So that's why the outcome is always questionable.
So that brings me to my next question. Coming from a Chinese background, my parents would use Chinese medicine, and they use Western too as well. And the common thing that I hear from older generation of Chinese people in Vancouver, they're always saying, well, TCM kind of treats the cause of the disease, and then whereas Western medication kind of, it controls it. So what do you guys have to say about that?
Do you want to let me answer that and see
please.
whether I've learned this actually from you properly? So Ian would actually say,
You're saying.
I'm saying it for him. I'm saying it for
Ian's
him
me.
because his English is a little bit.
That's true.
Yeah.
So, but seriously though, what was the question? No, it's.
The older people will also always say that the traditional Chinese deal with the basic problem.
Yeah,
where the Western medicine only deal with.
Ian's saying is that indeed that the Western medicine actually will treat the symptom,
the disease.
Yep, the disease itself, symptoms and signs perhaps, and trying to either treat the symptom or treat the disease. So it's either symptom modifying or disease modifying agents that we're now using. Whereas on the other hand, the Chinese or TCM, now actually not known as TCM anymore, I guess it's known as CM these days. It's
not
now
traditional
known as Chinese medicine, no longer traditional Chinese medicine. So CM deals with the host, so it restores the balance. As he said yesterday, basically each individual is a universe, so you're actually restoring the balance, and then the individual then within that balance, within that universe would then restore the harmony or the balance. Have I got it almost correct?
Get rid of the disease.
Get rid of disease.
From the internal.
But pragmatically, as I said yesterday, were you there?
No.
No, you guys weren't there. So
What's the most there?
I was there.
Okay, so you can't answer this. What's the most likely thing that happens when you get sick? What's the most likely thing that's going to happen when you get sick? You guys have all been sick.
You'll have symptoms? No?
What happens when you
You
get
feel
sick?
tired?
You get better.
You get better.
Or
Well, occasionally you die, but mostly you get better.
Right,
If
mostly
you
you get
didn't
better.
get better, we'd all be dead. So what is the best thing that you have going for you if you're treating patients from any discipline? Is the fact that if you don't kill your patients with your treatment, most of them are going to get better. And from you look at the outside, say, look, Dr. Jones, 99.9% of his patients get better. What a practitioner. But it's the wrong observation, but...
Well, it's the right observation, but based on a different theory.
Well, yeah, I mean, the problem is, it's if you look at it that way, the question has to be, what about, for instance, rheumatoid arthritis? Does TCM cure rheumatoid arthritis? The answer is no, it doesn't.
well, although the TCM docs may have an argument.
Well, I know,
on
but
that
we
one,
know they
yes.
have some rather poor studies with which they use TCM, and they didn't cure it.
So this is why we want to look at it.
Yeah, so it's not that TCM may not have something. The reality is we don't know what it has because they've never had disciplined enough studies and evaluations to look and see what would be good. If indeed you could show that in particular circumstances, a combination, whatever that combination is of TCM treatment, provided a better outcome, then why would you not use it? What I tell my patients is that Western physicians are hooders. We'll sleep with anybody who does gets good results. I don't care. I don't get
Can we
paid.
quote you on that?
I don't, absolutely.
And there's
don't
no
get paid.
consequences for using both Chinese medicine and Western at the same time.
We don't
right?
know.
Yeah.
Well,
Except
there's no
cost.
consequence if we know that the TCM treatment is effective, there will be no confidence. Well, no what?
Consequence.
No conflict.
Consequence.
Conflict.
Well, at this point, I'd like to make sure everybody out there know that, a lot of people think I'm a traditional Chinese medicine doctor. No, even though I'm a Chinese, I'm not a traditional Chinese medicine doctor. I'm a
wear a
Western
sign
doctor,
on your
even though
forehead.
I'm not Western.
Not a
Dr. Tsang
Chinese
is a named distinguished rheumatologist for the Canadian Rheumatology Association a few years ago.
Actually, you just want me to say that you were the distinguished
No, I
rheumatologist.
I'm going to stay out of this discussion.
Just to throw something in there, this could well be edited out, that's fine. Were you aware that some of the private fertility clinics, a couple in Vancouver, others in Canada, are using traditional Chinese acupuncture as an adjunct to their fertility treatments?
And I'd love to see their outcome measures.
Well, I would too.
The reality is what I tell patients is
Yeah.
having an MD doesn't stop you from being a damn fool.
No, but I mean, I don't think a private enterprise that's so specialized would look at throwing in an acupuncturist without looking at something of value.
You would think so, but it's not so.
You're very skeptical.
Yes.
But I'm going to go find out and I'll let you know
Yeah, but
what they're looking at, what data they're looking at, because that's what we're looking for now. We're asking the question, we're looking for proof, right? So are they looking at actually any good data around that idea? Or is it just a scam, just to look popular, just to look groovy? I get you.
Yeah.
I get it.
And your other question, which we didn't answer, was is it okay to use them both? The reality is the herbs that are used in TCM are active agents, and we have lots of data, not lots, but some data showing adverse events or adverse effects from herbs. We have no idea about whether there are adverse interactions between the medications we would use and the herbs, and there might be absolutely disastrous. We don't know. So it's what do you tell your patients?
Well, I tell your patient to listen to me.
Yeah.
Actually, three of us, what we're trying to do over the last few years is trying to promote traditional Chinese medicine. But we promote in such a way that hopefully the Western trained doctor will take a look at the traditional Chinese medicine with the way they know how and work with the Chinese medicine doctor and develop a good, healthy, sound research project to find out what is good and what's not good. Now, at the end, we will, like Dr. Huang said yesterday, there should be no Chinese medicine or Western medicine. It should be good medicine and wrong medicine. That we all refer our patient to see different disciplines. If you come in with arthritis, you have a gynecological problem, I refer you to a gynecologist. And why don't I refer you to a Chinese medicine doctor? The reason is that I know what the gynecology will do to my patient, which I refer to. I don't know that Chinese doctor what they will do. The rule of thumb is that when we refer a patient to a specialist, and we will go to see that specialist if we have the same medical problem. But if I refer you to a TCM doctor, I have the same problem, I probably wouldn't go see him. And that's why I couldn't refer you to the TCM doctor. Am I right?
Absolutely. But we refer to physiotherapy, and there weren't so many years ago before we had the interventions we have for rheumatoid disease, I used to say, if I only had one treatment modality to offer my patients, it would be a physiotherapist. It's still a very important part of the treatment. So people always have to remember that as Western physicians, we're not paid for the treatments we give. We're paid to make the diagnosis and make recommendations about treatment. I don't get any income from whether I prescribe a biologic or aspirin. It doesn't matter. I get paid exactly the same. In fact, it's more work to prescribe a biologic. So our job is really to evaluate and try to offer folks with, in our case, arthritis, the best and most well-documented interventions that will produce a good result. And if not, no one can guarantee no side effects, but be knowledgeable about the side effects, what may occur, and watch for them.
So another easy example would be with orthopedic surgery. 30, 40 years ago, we probably would not be referring patients as early as we do now to the orthopods for joint replacement surgery and all that, because at that time, failure rate is very high. We don't do the surgery, but we know about the results that they have. Yeah. And nowadays, this is probably where we are, maybe not even at that point yet, in traditional Chinese medicine, because we don't know whether it works or not. We need to know that, number one. Now that we know that orthopedic surgery, joint replacement does work, and in fact it lasts for 10 years or 15 years, we refer those people a lot earlier now. So we need to know. But what we need to know is, does the thing work? Before you even ask, can you use it together? Because as Ian and Barry said, some of them are actually highly toxic. One specific example is one of the vine that's actually used to treat rheumatoid arthritis. It's very, very effective. No question about that. No question about that. Works, but the side effect is also very, very, very high. So it's not everything is without side effects.
One last question. What's next for you guys? Do you guys have an exciting new project coming up?
Retire. No, actually,
No way.
Before we go away, I'd like to say that, three of us, actually, we are not against traditional Chinese medicine. Actually, if anything, we are actually supporting traditional Chinese medicine. But they need to give us something to base on to support them, right?
We need to help them with studies. They need to want to do the studies. We can't do the studies on TCM. We're not trained TCM practitioners. That would be a joke. But we need the well-trained TCM practitioners to want to evaluate what they're doing.
And eventually the answer may come, I suppose, just like psychiatry these days. I mean, when I went to med school, we never knew anything about these funny chemical that's going on in the brain. So at the moment, we actually don't understand this business about the qi, which unfortunately translates to air.
Well,
area.
In fact, it's essence.
Maybe 50, 60 years ago, if somebody tell you a ton of metal will fly in the air, you said monster, right? I think TCM probably in that stage. We just don't know how to explain it. But we're going to find out.
Very hopeful. Thank you so much, Ian, Barry, and
Now
Simon.
Ian and I will now speak in Cantonese.
Okay. You mean to do it again?